Greetings, everyone, and welcome to the Accessing Health Insurance Town Hall. This town hall is presented by the Prince George's County Memorial Library System and Prince George's County Health Connect to discuss healthcare access and open enrollment. My name is Carrie Gray, and I am the Adult and Senior Service Specialist for Prince George's County Memorial Library System, and I will be your moderator for the evening. Maryland Health Connection is the state health insurance marketplace. Health insurance is more important than ever amid a global pandemic, and it's open enrollment for 2021 plans in Maryland. Marylanders can enroll at marylandhealthconnection.gov. Today, we want to welcome some guests with us today: Jessica Sanchez, Tiffany Harris, and Sherry Curtis of Prince George's County Health Connect, a program of the Prince George's County Department of Social Services and the Maryland Health Connect. Jessica and Tiffany are navigators, and Sherry is the program manager. Today, we're talking about affordable health care coverage for Marylanders. Now is the time to sign up if you want to be covered in 2021. We are going to talk about options, about all of your options and how to get you covered. Now, health insurance is always important these days, especially during a pandemic. I can't think of many things that are more important right now. Can you all tell us about Prince George's County Health Connection and the Maryland Health Connection?
I can take that one. That's more of an overview. The Prince George's County Health Connect is the connector entity for our county. There's 8 connector entities throughout the state, and we are one. We're one of the largest ones, of course, because we have a higher density population. And Maryland Health Connection is the state marketplace under the Maryland Health Benefit Exchange. So when some people hear healthcare.gov, healthcare.gov are several states that are all under the federal government. But Maryland Health Connection is Maryland's own state exchange. So what we have is an opportunity for residents of Prince George's County to enroll in health coverage through the exchange. And if people are interested in getting insurance, today is the day that we're going to tell you about how to reach us, how to access health coverage, and what some of the offerings are. But I'll just kind of leave it right there. And your sound, it's picking up all your movement, Carrie-Ann. Your mic is picking up all your sounds. Lots of clicking.
Okay, I was muted, so I don't know.
I don't know where the clicking is coming from. Yeah.
Okay. All right. All right. So when can people enroll?
You can enroll right now, and open enrollment ends on December the 15th. So you can enroll right now for your 2021 plan that will start on January the 1st.
Right, and for Medicaid, it's actually year-round. So whenever you find yourself in a financial situation where you think that you may qualify for Medicaid, it's year-round. So whenever you find yourself in an economic situation where you may qualify, you can call us and find out for that eligibility.
All right. Thank you for that. Which types of plans are available, and also are testing and services for COVID-19 covered?
So there's actually many different plans available to consumers. Luckily, Maryland Health Connection is a one-stop shop. So it's one application. The consumer will call in or log in, whatever they prefer, and complete the application. And within that one application, the system will generate the eligibility response for the programs available. So if the person falls within the income brackets to qualify for Medicaid, they are eligible for Medicaid, it will tell them. If they surpass that bracket, if they're earning a little bit too much, then they may qualify for a qualified health plan. Now, what that is a paid plan, but the state offers financial assistance to help pay for those plans. So that's kind of the difference between Maryland Health Connection signing up for a plan through us versus going directly to the health insurance companies. So through Maryland Health Connection, the state offers financial assistance to pay for those plans. And the financial assistance is determined kind of on a sliding scale basis. So they'll take into consideration factors such as household size and household income for the year. And based on that information, which again was all put into the one application, they'll determine how much financial aid the state can yield to you that year. So it's all it's considered an advanced premium tax credit. So it's all based on taxes.
Emergency
You're muted, Tiff. Okay.
I'm sorry, I had to mute you, Tiffany. If you don't mind starting again, I might have to mute in between.
Oh, it's fine. I was just following up what Jessica said to answer your question. Yes, all plans do include COVID-19 testing and treatment and emergency care and prescriptions.
Right. And we actually recognize a lot of the insurance companies because we work with different companies such as Kaiser Permanente, United Healthcare, Maryland Physicians Care. We're working with all of these big name companies. So most consumers recognize the companies. And so, yeah, these are big names that I'm sure a lot of people have heard of in the past.
And this year for the qualified health plans, we have 3 carriers in Prince George's County. As she said, Kaiser Permanente, Care First, and then United Healthcare. And many of these carriers have multiple plans and different levels, silver, bronze, there's value plans. And so it really makes sense for the consumer to really shop and compare prices and also know what it is they need. If you know you need particular types of primary care, or if you have a chronic disease where you need certain things covered, you need to make sure that you look at the plan and get the best coverage that fits your needs as well as your budget. And that's why it's important to browse and look at the cost and compare the prices of the plans before you actually make your selection.
All right, thank you. So the next question I'm sure everyone is wanting to know, are the health plans affordable and what type of financial help is available?
So that kind of goes off of what we were stating previously. So again, it's all determined on the factors that are input into the application. So household size and household income. All of that is taken under consideration to tell you how much financial aid you're eligible for. Now, all of these plans vary in prices. And as they vary in prices, they do vary in coverage. So kind of piggybacking on what Sherry said earlier, it all really depends on what you're looking for. So all of these plans are available and you yourself choose what's comfortable with your own budget. So if you know that you're going to be using medical services more frequently, you're going to want a plan that covers a higher percentage of the medical cost. If you know that you're a person that just does their routine checkups and just wants that that access to the primary care, then you choose something that has a lower coverage percentage and that's a lower monthly cost. So it's all basically made to fit your budget. And like Sherry said, it's shopping. You're going to shop around to see what fits for you.
The other opportunity that we have, because we have several partners at Prince George's County Health Connect, um, we are embedded in the community. So our major partners are Healthcare Dynamics International, Mary Center, where these two ladies are navigators with Mary Center, Casa de Maryland. We're also partnered with Community Clinics Inc. and Seed, which is a small nonprofit in the Riverdale community. And all of the federally qualified health centers are partners with us. So we cover a large area. But one of the other important partners are our brokers. And they are producers that are authorized by the state. And these are people that run, their own insurance companies, but they also support us. And a lot of times when consumers get to a point where they're very confused and they don't understand which plan to select, we engage them with a broker so that they make the choice that fits their budget the best way. And so we do have an opportunity to also um, refer people to brokers so they can talk to an insurance company about which plan to select.
All right. Thank you. So, what do you need to enroll? What should I have ready?
Take that one, Tiff.
Okay. You need your photo ID, your social security card, your immigration and citizen documents, your pay stubs, tax statement, and policy numbers for any other insurance people. That's all.
We encourage people to have all their documents ready when they call, to make sure they bring everything to the phone to expedite the process because it's busy right now. We have a lot of people calling. And so it goes quicker for you and quicker for us so we can get to the next person if you have all of your documents with you when you make the call to call us.
Okay, sounds good. Um, how can people enroll and what kind of help with enrollment is available?
So there are many ways to apply. Typically, beyond the pandemic, we were functioning at the local Department of Social Services and scattered around. We were partnering with organizations that Sherry mentioned, so the small nonprofits throughout Prince George's County. People were able to go in person and apply. Unfortunately, given the situation, the current circumstance, we are encouraging social distancing, so we are working through the call center. So you guys can, well, the audience, consumers interested in applying, can call the call center phone number, and we are available. You will talk to real people, such as Tiffany and I. We are available to guide you through the process, so it won't be just some operator. We function through the call center. You're also able to apply through the Maryland Health Connection website, marylandhealthconnection.gov. There's also a mobile app called Enroll MHC, which is super user friendly, very colorful and fun to use. I think that it's made the process of applying a lot easier and quicker. It's super convenient because in the event that you need to upload the documents that Tiffany mentioned, you can use your mobile phone, take a picture and upload it. It's as easy as that. So there are many ways. So if you feel comfortable filling out the application on your own, if you've applied in the past and you think you've got the questions down, you can go ahead and log in online or on the mobile app. If you feel like you need that extra assistance, we're available. And MarylandHealthConnection.gov also has assistance in over 200 different languages. So don't feel excluded if you don't speak English. There is assistance available for over 200 different languages.
All right. So, open enrollment is for health insurance plans that start in 2021. Is there anything available for now for people who may be looking for insurance now?
Yeah, so there is what's called the special enrollment period. So due to this the current pandemic, we are in a state of emergency. And so Maryland has decided to open up that special enrollment period. It started off in the beginning of the pandemic, back, I believe, in April was when they opened up that special enrollment for anyone who was uninsured, who wanted insurance, that missed that open enrollment period last year. They were able to apply, and they extended that all throughout the rest of the year. So if consumers call in and they tell us that they want coverage starting for 2020, that coverage will begin December 1st if they call before December 15th.
Okay. Also, if anyone has any questions, you can go ahead and type your questions into the chat. And if as time permits, we'll allow the questions at the end. Also, for the next question, it's more of if you can give us some tips or just really tell people why is it important that you help people get covered? Like, what are the main reasons as to why it's important to get covered?
Well, I feel like it's important to have health coverage because you never know when you are going to need to be seen, need to go to a doctor, even pregnancy, just regular checkups. And like in today's world with today's pandemic, this was so unexpected and no one expected it to go like this. And I'm sure if everyone was covered right now, people will feel more secure and, more confident and being able to just live their daily lives. So I feel like health coverage is super important, especially in now today's world and how things are.
Right.
One of the things that also makes a big difference in terms of health insurance is one of the 10 essential benefits of health coverage is behavioral and mental health. And there is a real need in the community right now for people to be able to make sure that they can enter into some self-care, dealing with the pandemic and everything like that. And a lot of people don't know that treatment for substance use disorders and mental health and other kinds of things that that are societal issues and behavioral health issues are also covered under these plans. But the other really important thing to do, and I think Tiffany hit on that, it's about peace of mind.
Right.
And peace of mind is a really big factor when it comes to having health coverage. And we've seen now through the pandemic, even people that have lost their jobs and lost their employer coverage are coming to us and making sure that they have coverage. And so that peace of mind piece is really, really important. And the other reason is any kind of health disaster, breaking a leg, breaking an arm, something like that, could set your whole financial life back like years.
Right.
Because one injury like that could be as much as $10, $15, $20,000. And if you don't have access to that kind of income, that could, get rid of all of your savings for your new car, all of the savings for the house you and your husband were going to buy. I mean, something like that could really change your whole life. And so while some people struggle with identifying the funds to pay for their premiums, they do understand, and we're learning a lot more in Prince George's County about how people value health coverage. They understand the importance of having it.
Right. And just to piggyback off of both of them, definitely medical expenses, medical debt is actually one of the top reasons for personal bankruptcy. I think that is so important to note. Just what Sherry was saying, that breaking a leg, accidents happen, we don't plan on getting sick. We don't plan on hurting ourselves. We don't plan on ending up in the ER. And then we're hit with all of these medical bills that were, again, unexpected. We didn't plan for them financially. So medical debt is quick to drain personal savings and put anyone into bankruptcy. So it's just to protect yourself against those unexpected costs. And right now with the current pandemic, we see how easy it is to get sick. Well, we don't want to get sick, but unfortunately, our bodies, we're, we are susceptible to viruses such as the one that's here today. So it's just good to have that peace of mind, as Tiffany stated, to be protected. Currently, the health insurances, I'm not sure if it's all of them, but most of them are covering the COVID-19 tests. And also, some of the plans are fully waiving the consumer's costs for treatment for COVID-19. So, you could end up in the hospital. We don't want that. But if need be, you have that coverage. And that's in addition to the basic essential services that we all need. So primary care, going for your routine checkups, sick visits, maternity care if a woman gets pregnant, immunizations, all of that is considered essential services. So on top of that, we do want to look at the extreme cases, but also the day-to-day things.
Okay, thank you. So I know you talked about a little bit about this, but if you just want to reiterate just a little bit more on why is health coverage so important this year? I know they asked it kind of twice, but reiterate. I thought it was very interesting how you talked about some of the other uh, reasons why people might, you know what I'm saying, need health care. But what really makes it important this year? If we can just reiterate that for the people. And
So again, just the obvious, right, is the current pandemic that's sweeping internationally. Coverage for the preventive side, which is just getting tested, and once if you are detected, that coverage for treatment. As Sherry said, being stuck at home, unfortunately, a lot of people have suffered in different aspects due to the pandemic. So, certain people are dealing with loss of a loved one. People are dealing with loss of their jobs, which can put anyone, in a bad place emotionally. So, as Sherry mentioned, that connecting people, that access to mental health care services is so important right now because everyone is suffering in a different way. Working from home, it's been for the few that are lucky and blessed enough to be working from home, it's a big change. Um, but there are people that have lost their jobs completely, and we hear it day to day. I think Tiffany and I and the rest of the navigators, we hear how many people are losing their jobs, and they don't know how they're providing for their families. um, Kids with the online school, they've lost that social aspect. It was fun to wake up. They had something to look forward to, seeing their teachers and their friends. So everyone is being affected in a different way, with different ages. It doesn't matter, and it's affected all of us in a different way. So just being connected, to make sure that you are physically and emotionally taken care of. I think that's what we want to stress right now. So I think that's the big thing for this year.
And I'd also like to add that, it's also a good time for people to focus on their health. And we have a lot of poor health outcomes in Prince George's County. There's a lot of people that have diabetes, a lot of people have high blood pressure. There's a very high incidence of a lot of diseases that people could manage better if they had health coverage and were working with a doctor for their wellness care. Not everything has to be for sick care. And it would be helpful if people had health coverage and worked with their primary care doctor to sort of achieve their own maximum level of health. So even during this time, if people had health coverage and they were not working, and they were at home, they could use some of this time to focus on improving their health. And that would be a good thing for the entire county.
Thank you. I definitely agree. I can relate to the big changes of working from home, and I'm sure for people, who have lost people due to COVID or just the whole change of it. I think you guys have illuminated some great points about reasons why getting enrolled this year is important, and period. Um, Once again, as
Well,
we
there's
talked about.
another group of people that we'd like to talk to too, because those are the people that are turning 26 and are no longer going to be on their parents. And
Yes.
some young people, depending on their income and the kind of jobs they have, they don't want to start spending money on health insurance because that takes away from other things that they, need their resources for. And so we also want more young people to understand the importance of having health coverage, because that is a large audience for us that really needs to pay attention to making sure they're covered. Because you don't want to have a situation where you're young and just getting your career started or just getting your independence started and then end up with a $20,000 medical bill, which may be bigger than what you owe for your college debt.
Exactly. You don't want that debt.
Yeah.
I think that was very real when Jessica was talking about, sometimes you have an injury or something to put you down financially to add that on. So I hope young people are watching. I hope, older people who are watching just spread the word, refer them to this town hall, make sure to get enrolled. Everybody, you mentioned that you have an app, and that's pretty much easy. It makes it easier to enroll. So I hope everyone takes advantage of that. And I know that COVID-19 testing and treatment is on the top of mind of people. But what else is covered? What are some of the other things that we don't think about that is covered?
So, essential services include things such as those routine checkups, so the annual physicals, sick visits, trips to urgent care, because I know sometimes, when we get sick, the typical primary care offices aren't open. So we seek attention in urgent care centers, hospital visits, inpatient and outpatient, maternity care, and newborn care. Um, and one that I think a lot of people don't know, substance abuse is considered essential service. So if you struggle with any type of substance abuse, maybe drug or alcohol, um, you do have coverage for rehabilitation services. So that's a big thing. As Sherry mentioned, mental health services, mental health conditions, mental health rates are super high and prevalent. So it's important to communicate that accessibility to mental health care services. And I know I'm missing some of you want to piggyback onto that, Tiffany.
I'm sorry, Tiffany, I muted you. Just getting a little bit of background noise, but did you have
My
anything
sound
to
is
add?
bad. It's really muffled. I can't hear good.
Okay. All right.
Can you hear me? Because I can't. It's like really muffled, and I feel like it's a
Yeah, I can
situation.
hear. Yeah, I can hear you. It's just a little bit of background noise that I have, so I was just muting you in between. I don't know if Sherry has anything to add. Um, if not, I can go
I
to
don't.
the
I
head to
have
the
it on
next question.
too.
Other plans that are available for people are also dental.
Right.
And so dental coverage is available under the exchange. Some carriers include it, and some people have to pay and buy their dental, extra as a separate coverage. But it is available and offered to everyone who has access to and is eligible for coverage. I also wanted to share a little bit about some people who are not eligible. There are people who are undocumented and they're working every day, but they're not necessarily eligible because of their immigration status, but the children are. And we really want people to focus on making sure that all the kids are covered. And so even if the adults are not able to get insurance under the exchange for whatever reason, we want to make sure that we get the kids covered. And so we really want to push that. I mean, we cover kids in the plans, and our general coverage is for 18 to 64. And I believe you have a flyer that has all of that information on it. Um, but those are mostly the benefits that are covered. Just about everything you can think of, you know, was included in this in the Affordable Care Act, which has been going now for we're in open enrollment year 8 in terms of the exchange, and so and many of our staff have been with us for that entire time, and so all of our navigators are really, really professional. Many of them are bilingual. We have access to other languages as well. Some of our navigators speak French, some Portuguese, some Spanish. So we're able to assist residents in our community.
Thank you. Wow. Y'all hit on a lot. I think that's important to know. So even if the parent might not be able to get coverage, the children are able to get coverage as well. I think that's very important. And also, you mentioned dental. We don't want to neglect our teeth. And a lot of people think that, some things do they have to get specialty insurance or anything like that. So I think that's good information to know. I guess I'll ask a question too. I don't know if anybody else is thinking, but I'm a glasses wearer. Are there anything covered as far as eye exams or any general eye health, anything?
It really depends on the plan.
Okay.
You can, if you have that need, and that's why we emphasize the shopping aspect, because you want to make sure that the plan you select covers what you need. And so if eyeglasses and eye care is what you need, then when you're shopping and talking to the navigator or even the broker, that's something that you need to share so that you make sure that the coverage you get will provide you with that. You don't have to buy a separate plan for eye. You just have to make sure that the plan you select covers your needs.
Thank you. So there's many different plans. It's almost like you can build what is right for you.
Absolutely.
And you can view it on the site once you enroll. Is that what I'm understanding?
Yeah, so once you fill out the application, it will list all the programs that you are eligible for. Like I mentioned in the beginning, it will tell you if you are eligible for Medicaid, which just in case anyone doesn't know, Medicaid is the government benefit that covers all essential medical services. For kids, Medicaid does include vision and dental, but it would be very limited. So it would be limited to kind of what's considered routine care. So it would be the two dental cleanings, a year, checkups and cleanings, fillings and extractions are a part of that. Now, certain paid plans do have an add-in, and you'll see that it says within the plan name, it will say the name of the plan / dental or / vision. That kind of means that that company and that specific plan has incorporated a portion of either dental or vision coverage. So like Sherry mentioned, it's up to you to look and see which plan best meets your health needs.
Okay. Thank you. Thank you for that. And I know we talked about it a little bit, but I don't know if there's anything at this point if you want to add or you want to think about it. But we mentioned that it's a stressful time right now and the importance of mental health. What so mental health care, well, I guess what is covered in a plan, I guess that's what the question that they're asking. Tell us about the importance of mental health care being covered in these plans.
Well, each mental health coverage is one of the 10 essential benefits that was passed in the law.
Okay.
For the Affordable Care Act. And so it is one of the essential benefits. Before the Affordable Care Act, mental health coverage was not offered by many plans at all. Treatment for a substance use disorder was not covered. So the Affordable Care Act really did give that opportunity for that kind of coverage. So it's not about the type really of mental health care. It's about making sure that your the provider that you choose offers that service. And so a lot of the clinics and a lot of the providers offer that. And when you select your plan, you get a list of providers and you can select a provider that offers that service. So um, mental health care and behavioral health care is available through your plans.
Right.
Okay.
And I just kind of want to reiterate what Sherry said. So um, with individuals that have a provider of mental health services that they know and that they've bonded with, it takes a lot to establish a trusting relationship with any type of provider. But I think for something as sensitive as mental health, I think that you want to make sure that your provider takes whatever coverage you have enrolled in. So it's just a matter of calling in and checking and asking the provider, the mental health provider, what carriers they accept. And that way you kind of get an idea for who to look for when applying for coverage. Because I think just maintaining that relationship is important.
That's a real good tip.
Yeah.
That's a real good tip. So reach out to your current providers,
Right.
and then compare online.
Mhm.
So that's a good note for everyone. Um, so I have a question for you all. What do you find confusing, or I guess if you want to address any common misconceptions about healthcare and coverage?
Well, there used to be a really big stigma around Medicaid, and a lot of people didn't want government health insurance. They didn't think it was the quality, And I think that what's happened now with expanded Medicaid in Maryland and the opportunity for people to understand that it's just basically income based and it does not affect the quality of your care. Many primary care providers and many physicians take Medicaid. So, a lot
Mhm.
of what we're trying to do is remove some of the stigmas. But Prince George's County Health Connect, we're not providers. What we do is we're the bridge. We connect the community to access to healthcare. But then
Good
once you
point.
make your plan and once you make your selection, negotiating your needs in terms of your healthcare has to happen between you and your trusted provider. What we want to do is make sure that no one in Prince George's County is not covered. Anybody who's eligible needs to get coverage, and our job is to try to enroll as many people that are eligible into Maryland Health Connection so that we can have a healthier community and a smarter community and people that are more aware of what it takes to be able to function, particularly during this time.
Okay. I think that's a good point. You are the connection. Awesome. This one might be more directed towards the navigators, but is there anything that you now know that you wish you knew before about health coverage?
I think the biggest thing that was my misconception before entering this scope is if you don't qualify for Medicaid, insurance is unattainable, it's unaffordable. But as we've mentioned all throughout the program today, if you don't meet the income brackets, because I do want to state that the income brackets for an adult to qualify for Medicaid are extremely limited. So, unfortunately, you may consider yourself low income and you may think that you can't afford it if it's not free. But with the financial aid that is yielded by the state for you to pay for a plan, it does come out to be extremely affordable. I think a lot of times the hesitance is, oh, I don't qualify because I earn too much. 9 in 10 people last year qualified for some type of financial aid. That's 90%. That's a lot. Even if I just want people to not exclude themselves just because they assume they won't qualify. I've always taken on the mentality it doesn't hurt to try. So I think I just want to pass that message on to any consumer listening, that it really doesn't hurt to try. You set aside 30 minutes to fill out the application. We are more than happy to guide you through it if you're intimidated by it. It's typical questions. So the typical, we'll ask the people in the household. We'll just need the date of births of everyone in the household. We'll ask for income, their legal status, and am I missing something, Tiffany? I think that's the basics. It's just who lives with you, what are their date of births. If they're applying for health insurance, we're going to need their socials. You're going to need your home address, mailing address. So the basic things, I think that everyone should have access to that information. And once you complete that application, you'll be able to see what you're eligible for. So I think that's the biggest thing that I want to emphasize today is don't exclude yourself from something. Take the moment to take the chance and see if you are eligible, because more than likely you are eligible for some type of financial assistance.
Okay. We got a comment of support here from Jean Gray. Great job. Great info, especially in this COVID time. And I see you. I'm going to unmute you, Tiffany, to see if you have anything you would like to add.
Give it a try, Tiff. Not working.
Yeah, I can't get sound from Tiffany. I think it says because she chose to mute herself.
Nope,
I
it
don't know
still
if we
says
haven't.
muted.
Oh, there we go. We can hear you, Tiffany, now. If you had anything you want to add. Okay, it went back to mute. I don't know what happened. While we're working on that, I am going to go ahead and do a screen share to we can hear you, Tiff, if you want to talk. I'm just going to actually go to the website so everyone can get to see it. If you have anything, you can go ahead.
I'm not sure if you can hear me.
We can hear you.
Okay, well, just to piggyback on what Jessica was saying about one thing that I wish I would have known now that back then that I know now is having a job. Sometimes when you look at your paycheck and your health insurance is deducted out of your paycheck, I never knew that even though you work, you will qualify like for a QHP plan. And recently, like I've encountered a lot of individuals where our plans are actually lower than what's been taken out of their check or what they're paying like through other agencies, like going directly to them. So that's something that I wish I would have known, even, being young, growing up, always just accepting the insurance that comes from your workplace. Sometimes it's extra high. And even when you're losing a job or transferring jobs or positions, you're offered a COBRA plan. And with that plan, it's extremely high as well. And when you're going through that stage, it's like a good time to, connect with Enroll and Health Connection.
That's true.
So this is the homepage. Yeah, this is the homepage of our website. And if people want to know how to reach us, they can click on to either one of these download buttons and they can get the flyer in English and in Spanish. Because we are working virtually and we don't have locations for people to come see us, we do have 4 call center numbers that are available for people to call. And that way, people have options for calling.
I just wanted to add one more thing for our immigrant families. So another thing that I'd like to add that has been kind of a common misconception is individuals with the legal status that deems them eligible for health insurance. Sometimes they think they have to be a US citizen in order to apply for these benefits. You don't. We see various immigrant statuses. So again, it's always good just to call in and check because it doesn't hurt to try. But typically, if you have a social, I think that's kind of the rule of thumb, but there are certain visas that qualify as well. It's kind of a long, exhausting list. So I don't want to list out all of them and miss out one. But I would encourage anyone who is in doubt if they qualify based on their legal status to call in and double check just to make sure that they are not excluding themselves from assistance based on that legal status. We can't hear Sherry.
Sorry.
All right. Thank you all. Is there anything else that you would want to share? I don't have any comments or questions come in. If you want to remind people important dates or anything to keep in mind and remind them again of how to sign up, I appreciate it.
Did you have a copy of the flyer?
I do. I can bring that up if you want to go ahead and give me a little
I
lead
think the
in.
most important thing right now is if people really are interested in getting health insurance, that they should do it now. Because if you wait until December 13th or 14th, it could be really crazy and hard to get through to us. And so we like to push people to just do it early. You just get it over with. Go ahead and get your 2021 plan either renewed or get your new plan and call us now. Our navigators are available every day from 9 to 4. We have a couple nights a week that we're open until 7. Our health hotline is open every evening until 7 p.m. And we also are available every Saturday from 10 to 3. And so people can call us at any of those numbers. And, if you have trouble getting through, just try again because we are there every day, all day. And that's the most important aspect right now is for people to do some browsing, go online, look at the application, get started. Even if you come to a stop and get most of it done, then, it won't take you too long to finish your plan selection and finalize your application. So we're encouraging everybody to do it now and not wait until the last minute. The deadline is December 15th. And so it's important that people know that. But on this flyer, which is also available on the website, if you go to our website, it's scrolling at the bottom of the screen. You go to our website and you click on either English and Spanish, and you will get this flyer, which has all the information about how to reach us, what you need to have ready before you call us, the hours that we're available. And we have these flyers circulating all over, even the libraries. I want to give a shout out to the libraries because the libraries are actually putting these flyers in the curbside pickups at the locations at the libraries. And so we just want everybody to let everyone know, because everybody knows somebody that doesn't have health insurance, to let everybody know that this is the time to make sure that they're covered so that they can reach their own maximum level of health.
Right. And just as a reminder, right now the open enrollment period is November 1st to December 15th. So after December 15th, typically you are unable to apply for insurance outside of that time frame unless you go through a big qualifying life event such as getting married, getting divorced, having a baby, or adopting a baby. So there is a Right, losing a job. So there are limited circumstances where you'd be able to qualify outside of this open enrollment period. So if you don't think that you're going to go through something big like that, it would be best to take advantage of the open enrollment period through December 15th.
And I think Jessica mentioned before that Medicaid is year round. And so there's no open enrollment period for Medicaid. So even if you go on and you see that you qualify for Medicaid, we still will be able to help you.
Okay.
Most people that are receiving Medicaid now have been extended through the end of January, and we expect that it's going to be extended again. So even if the date on your card is expired, you probably received a notice that you can still access Medicaid even though it may be expired. So the state has really worked hard with the feds to make sure that everybody who has a card and is a card carrying member is still covered. So we're doing everything we can to make sure that people are not worried or nervous or feel like they have to come to the DSS office because we're not open, that, please just give us a call and we'll do our best to make sure that you get what you need.
Thank you. Thank you for that. So without any more comments or questions, I think we're ready to close. Just on behalf of Prince George's County Memorial Library System, I want to thank our co-presenters, Prince George's County Health Connect, our guests, Jessica Sanchez, Tiffany Harris, sorry about the little technical issues we're having, and Sherry Curtis, and the viewers for tuning in. Thank you all. And as always, check out PGCMLS for more virtual events, community resources, and free online resources with your library card at www.pgcmls.info. Thanks again and good night.
Good news. Children under 5 who live in Prince George's County are eligible to receive a book in the mail every month courtesy of the Prince George's County Memorial Library System and the Dolly Parton Imagination Library. Sign your child up today at the web address below.